Welcome to Health Literacy Out Loud. I'm Helen Osborne, President of Health Literacy Consulting, founder of Health Literacy Month, and author of the book Health Literacy from A to Z. I also produce and host this Health Literacy Out Loud podcast that focuses on many aspects of health communication, patient education, and health literacy. Today's guests are two leaders of the new United States Health Literacy Association, otherwise known by its initials USHLA. Karen Komondor is a nurse, and she's also the co-founder and president of USHLA. Recognized for her ongoing leadership and expertise in health literacy, Karen's passion comes from knowing why, both personally and professionally, understandable health communication matters so much. Karen is founder and president of the company Health Literacy 360 LLC, a consulting and training firm that focuses on enhancing healthcare communication practices. In all her efforts, Karen pushes the boundaries of health literacy initiatives through collaboration. Monique Hill is a social worker, and she's also the Secretary of USHLA. Monique also is the founder and lead consultant of HLP Help Solutions, a health equity consulting firm launched in 2022. Prior to this, Monique served as an associate professor and health literacy and partnership engagement advisor for the National Network of Libraries of Medicine, Region 2. Monique's ongoing mission is to ensure that every community has the tools, the understanding, and the support it needs to take charge of their health. Karen and Monique, welcome to Health Literacy Out Loud. And thank you both for taking a leadership position in this brand new and very exciting USHLA. So let's take it from the beginning. What is this association and why did you go all the effort to make it happen?
Well, thanks, first of all, Helen, for having us. We are so excited to share this new venture with everyone. Basically, the U.S. Health Literacy Association is a grassroots national organization that formally launched in May.
May of 2025.
May of 2025, correct.
Okay.
And it really was formed organically through just different conversations with different experts across the country who saw the need. So about a year ago, we formed as a 501c6 rather than a 501c3.
But that's a business structure.
Right, that's the business structure. And we formed as a 6 so that we can not only raise awareness, but we can actively lobby for policy change at the state and national level. So that's the difference from a 501c3 to a 501c6. Gives us the ability really to be in the rooms where decisions are made, pushing for laws and systems that make healthcare communication clear and equitable for all Americans.
But you also said, Karen, it's grassroots, it's national, it's volunteer, but you've taken on this important business structure with a very looming kind of a title with a big, big mission. That's a lot to be thinking about and working towards.
It truly is. And like I said, organically it was formed. So we currently have a full executive board consisting of 4 officers and 4 directors. And our whole goal really is to create this organization that's policy powered and advocacy driven.
Oh, well, let me make sure, policy powered and advocacy driven. Monique, you want to add more to that?
Sure. I think Karen beautifully stated kind of our intent in as it relates to health literacy and national and state local policy. So when we say policy powered, we want to make sure every single state across the U.S. has the tools that they need to organize around health literacy, bring organizations together who are already doing the work, because we do know that the work that we are doing and championing through USHLA, there's a lot of incredible work that's already been done. So we're bringing that together. In terms of the advocacy part of it, we want to make sure that professionals who have just started off in this career field also understand the importance of policy and advocacy, whether it's on a government level or if it's internal to their organizations. We've heard a lot of feedback about early career professionals who are in organizations who are doing health literacy work in silos. And so we are hoping to also equip them to be able to advocate for more collaboration within their organizations.
Oh, thank you. When I started out doing this 30 years ago, I first heard about health literacy, and I was working as an OT in a small community hospital in Boston on the psychiatric unit. I heard about health literacy. I heard that a lot of people have trouble understanding, and my initial question was like, yeah, of course they do. I never thought about it before. What can I do? But I was a voice of one. And I know what that's like to feel the need kind of deep inside and that passion, but to have to start from the very beginning. Okay, what can I do? Your new association, it's very interesting to me that you're focusing on policy and advocacy. And we need those. Boy, I would have needed those in my early days too. I think I need them now all as well. What you didn't specifically mention was the how-to of health literacy and the how-to of plain language and clear communication. So you talked about all the good work people are doing. Is that assumed, or is that happening other places? And you're looking at bringing that together in a national cohesive way?
I can say yes. We do know that there are people across the country that are doing the work of health literacy, and we've known for a couple of decades now what the problem is and what the solution is. But as Monique mentioned, many are working in silos. One committee I worked on locally, members voiced extreme frustration because they wanted to move some of the work forward. But the problem over the years is that none of these strategies are mandated or incentivized, because we know many organizations have competing priorities, so many things that they need to report on. So health literacy becomes something that, it might be nice to do, but few organizations have policies in place to actually implement or train on these strategies. So that's one of the main reasons we came together. A few years ago, we did attempt a policy change by writing a proposal to the Joint Commission to elevate health literacy to a national patient safety goal. And had that come to fruition, organizations would have been mandated to put some of these things in place.
And that didn't work out the way you wanted it.
No. So we pause, we pivot, and we say, what's next? So this is what's next.
Boy, can I relate to that? Even in my hospital days and now in all my health literacy consulting work, I'm well aware of competing priorities for our time, for our attention, for our policies, and been continually looking, and particularly for organizational health literacy, what's that hook to get those senior people at an organization or at a governmental level to keep making that happen. So I applaud you for pivoting, as you said, finding that gap, realizing what didn't work and what might work now. Monique, what's the vision of how this might come together?
I think the vision is, just as we've said before, in terms of collaborating and bringing together individuals and organizations for those who are listening to join, we have a couple of ways that you can be active and involved in terms of how we're bringing people together. So, of course, there's individual membership. That is anyone who wants to join professionally, to tap into resources, to get some tools to understand and better advocate. We have an organizational level membership as well. And our goal with the organizational memberships is obviously any organization that has employees and experts and teams that are working on health literacy, we foresee that being a very good resource for them to engage their membership base. And then I think in terms of leadership, we have a lot of, and as you know, Helen, I've shared before that compared to the expertise of both you and Karen, I would be considered probably a mid-career versus an early career. So I've got some years under my belt, but I have a lot of years ahead of me in terms of career. And, for folks who are in the early career and mid-career and maybe late career as well, this is a place that we can join other professionals. We can advocate on the 3 different levels, whether that's your organization, federal, state level, or even local level, because in the state of South Carolina, our public health departments are local, and some of the work that's being done in the health literacy space is through community health workers. So we recognize that there are multiple layers and levels of opportunities to advocate. And I had a thought when Karen was talking and sharing just a few minutes ago about where we've come from in health literacy. And I was thinking, up until recently, there was not a definition of organizational health literacy. And so being able to educate on things in the history of health literacy and what that means to the field and also what that means to individuals, I think this organization is going to serve its purpose well in all of that. And I think also just recognizing as a leadership board, as the visionaries behind this organization, that we're not the first. There have been various organizations to be dreamed of that maybe didn't make it to the phase that we're in. And we recognize that we want to partner. We don't want to replace. We don't want to duplicate. We want to encourage that collaboration also across organizations.
Thank you, Monique. I was writing little notes. I want to kind of keep following up. I have had the privilege over all these years to talk with people doing the everyday work, maybe the new career, or people like me when I first heard about it, on the mid-level. And I've also visited organizations that pride themselves. We are either working on or we are a health literate healthcare organization. Those are rare. And I often meet with their executives like, what's the magic? How did you get there? Some groups have done it, but the fact you're taking it on, as you both know, I love stories. I love the people part. Monique, you talked about the early career. You represent the mid-career. Karen and I, we've been doing this a while. Just one of you, tell us a story about how this might help someone at one of those levels. How can they get involved with the organization and get what they need and contribute and help others? Early career, mid-career, been seasoned.
I'll definitely share a story. So early career, when I started in health literacy, and I tell this story a lot because it was truly a calling that was brought to me. I had no idea what health literacy was before I started my career. But I just remember being one of, if not a few, or the only people on my campus at that time who was talking about health literacy. And I can recall that there were organizations and programs on campus who had funding, who were doing health literacy projects, but no one really was talking about what this meant as a academic center and also as a healthcare facility. And I remember my first opportunity I got to get some professional development. I applied for a junior faculty fellowship. And the fellowship would allow for me to really dive deep into equipping myself to be a health literacy expert on the campus. And I did so. And I met the late Dr. Bonnie Braun, who agreed to mentor me and provided me so much support and just guidance in my early career. And before I knew it, I was talking about health literacy so much that I had started small committees. I had started, programs. People were seeking our little department out to work on programs. And I think that was just a little spark that was made that really caught the attention of different people because, like I said, health literacy is still a word that some people just really don't understand.
Or we don't understand it the same way.
Yeah, and I think the work that we do is often not as valued for many reasons. The understanding of it, which is the irony of health literacy.
Okay, you're right.
Then also the value of health literacy not being a direct monetizable type of program or line item in a healthcare organization budget doesn't really return on the investment immediately. So it's hard to show that impact in ROI.
Thank you for sharing that. What I'm hearing about in your story is it took you. You heard about this. You didn't go out seeking this. It kind of came to you. And then you got it right away and somehow internalized the importance of this. And then you did what was needed to get you the help and support and guidance you needed. So you are a go-getter from the inside out to make that happen. I relate to that a lot. And I remember those lonely feelings. So I think that's one thing that got me so excited to hear about this great big US-wide initiative is because we don't have to each keep finding our own way out there and acknowledging the reality of what's happening. I've been around long enough. I know that the role of the federal government has played in getting health literacy to where we are, creating a structure for health literate healthcare organizations and the Plain Language Act and, all kinds of the roadmap for health literacy. That's on maybe shakier grounds right now or older news. So the fact that your association of like-minded individuals and organizations, very exciting. Karen, tell us a story. You can fit in wherever you want. I see you as very much of an organization person. I've done another podcast with you and you talk about the organizational side. You know how to make things happen on a big scale. So share a story for listeners about what they can get from this new association.
Well, I'll tell you, when I started, it was back in about 2007. I was working as a director of organizational development at the time, which means I was in charge of staff and patient education. And our organization received a grant to look at health literacy. At the time, I had no idea what it was. But
we all start there.
And I was asked to lead the efforts in our organization. But so I did all my research. I connected with folks who were already active in the field, and I realized that health literacy, now there was a name for an issue I struggled with for years because 3 of my siblings, all diagnosed with a rare debilitating disease when they hit their 30s, we went through numerous specialty office visits, hospitalizations, surgeries, and hit barrier after barrier after barrier because of jargon and miscommunication, etc. So that, in the beginning, when you introduced me, you talked about how important it is to know your why. And that's really my why. And that's what keeps pushing me, pushing the boundaries of what we can do in health literacy. Because I've seen over the years, we were successful in my organization because we had senior leadership that we communicated with in a way that they understood the importance. So I had backing from the senior leadership, the mid-level managers. So I was very proud that we were able to really institutionalize health literacy across the continuum of patient care at my organization. And unfortunately, my hospital closed in 2022. So that's what launched, my health literacy business, and is what's pushing me to continue to work at the policy level now. I'm thinking this is the only way right now that we can actually get some of this moving forward.
Thank you for those stories. I hope listeners will relate to them. I certainly do. And Karen, I keep coming back to that word. I've heard you say more than once about pivoting.
Mm-hmm.
Your hospital closed. I got involved with this. I did not have the support of senior leadership. And I pivoted actually to create Health Literacy Month. If I can't do it there, let's do it all together.
Right.
And Monique, you sought out your own advisors, and look where you, or all of us are now. I think that's really exciting. What is the vision ahead? You're 1 year into this. It's a little baby organization with a huge vision. 5 years out, what will you be thinking that, oh, gee, we did it. We made a difference. What would it look like?
Well, I'd like to share the vision of our organization. We really envision a future where equitable access to healthcare and informed health decisions are the norm, right? But it's all driven by policies and initiatives that prioritize health literacy at every level of government and society. So instead of being the exception, we want clear communication now to be the norm. That's what we envision.
It's a big vision.
Mm-hmm.
Monique?
It is a big vision, and I think it's a very timely vision because of just where we are as a society, with information being so freely weaponized, whether it's, good information with good intent, but once it has traveled a little bit, it ends up not being accurate. And I also think on the other side of that, on the larger level, with information suppression and people lacking trust in media sources and otherwise reliable sources, that, this organization and the vision is perfectly aligned, because it's going to take a big vision to be able to get us to where we need to be and to get people where we need them to be in terms of closing that gap in personal health literacy and also organizational health literacy. So we've got a big vision, but I think the vision is so on target, and with the work and the amount of people who have already joined the organization, express support, especially you, Helen. Thanks for having both Karen and I. I have to also acknowledge Karen as a leader, because she is fearless and she's leading this organization. If there's no one else to see this vision through, having Karen at the helm, we are in good hands. Trust me.
Thank you, Monique.
I think we are with all of you. Your board's amazing. Your vision, it's a great, big, big vision. Before we go, for people, and I know you want members, you want leaders, you want volunteers, there's opportunity for everyone to get involved and to share and collaborate and learn and connect and together make a big difference. Where can they find more information?
Basically, go to our website. It's ushla.org.
Okay, we're going to have that on your Health Literacy Out Loud webpage, plus any other, links that you want to each of your businesses to learn more about everyone. This is so exciting, and I applaud you, and I hope that listeners learn, join, and spread the word, because it needs everybody, wherever we are, early, mid, late, career, wherever we're going. Together we can make a difference. Thank you both for being guests on Health Literacy Out Loud.
Thank you so much, Helen, for having us.
Thank you, Helen.
As we just heard from Karen Komondor and Monique Hill, health literacy is important. We all know that. But it's also important to have a big vision of its potential, policy, and advocacy in addition to practice. But health literacy isn't always so easy to accomplish. For help clearly communicating your health message, please take a look at my book, Health Literacy from A to Z. Feel free to also explore my website, healthliteracy.com, or contact me directly at helen@healthliteracy.com. New Health Literacy Out Loud interviews come out the first of every month. Get them all for free by subscribing at healthliteracyoutloud.com or wherever you get your podcasts. Please help spread the word about health literacy out loud. Together, let's tell the whole world why health literacy matters. Until next time, I'm Helen Osborne.